Alabama is ranked #3 in maternal mortality and #1 in infant mortality. I came into birth work in 2017 after the birth of my oldest son. I had a very traumatic birth experience at one of our local hospitals here in Birmingham. The medical errors that occurred in my care that resulted in us being hospitalized for about 3 weeks postpartum. I experienced a ton of discrimination and microaggressions from our nursing staff while we were there.
I am the owner of Oasis Women's Health and Oasis Family Birthing Center. The model that we have here, which combines midwifery and obstetrical services together, is a potential solution to the poor outcomes that we've been having within our state.
The importance of having OBGYN care and midwifery care and how those worlds intersect or how they may differ is primarily that we want to challenge the narrative that's out there. It's important for folks to know that other options exist. We're not just talking about their health, we're getting a whole picture.
Everyone is seen by an OB throughout the pregnancy. You do the majority of your visits with a midwife, but you're seeing the OB throughout. So you develop a relationship with the OB. So if you need their help, you've already established a rapport and you have that person who's not judging you for wanting to do something that is different. And so I think that's a critical part of the model.
There were thousands of midwives, mostly Black midwives, working in Alabama, in Mississippi, across the South. Beginning in the early 20th century, there was a systematic, intentional effort by the white medical establishment and the state policymakers to push all birthing people in Alabama toward doctor-attended births in hospitals and to criminalize midwifery, which is what happened actually in Alabama. It was effectively outlawed by the 1970s. The reason that we do not have many midwives in Alabama or in the South is not because the care they provide for low-risk pregnancies is inferior to physicians. It's because they were taken out purposefully out of our healthcare landscape.
So Charity was the first midwife to do a birth center birth within the state of Alabama. When we posted about just the first birth here, we had such positive feedback on social media. I think we got like 77,000 impressions just because people were so interested in what birthing centers are, what that means for Black women, and what it would look like in Alabama. So I think people were very interested and very supportive. Highlighting solutions lets people know that there are options available, but it also can highlight when options aren't available in your state, right? And then you ask the questions, why isn't it available? And that leads us down the path of what are the current laws? What are the things that are inhibiting us from having access to things that we should have access to, such as birth centers? As people who want to provide birth center care, putting these solutions out there or these possibilities out there makes people ask questions.
In reporting on birth centers and the women who are trying to open them, I learned that the state of Alabama was trying to get out ahead of these birth centers that are in the works by coming up with a set of regulations that would govern how the birth centers run. And I think most everybody agrees that the regulations are a good idea, but the way that they were wanting to implement them was in a way that would cut midwives almost completely out of the equation when it came to birth centers, that licensed midwives would not be able to work in or run birth centers, which would close one of the ones that's currently in the works and would really potentially damage the other two.
What we need the most is legislators who are educated about midwifery care. I spend a lot of time lobbying and talking to congressmen, senators, House representatives here in Alabama who just don't know or don't understand the educational process and the training process that midwives actually receive. Not only do we have to have an accredited degree program, but we also have to have, a certain amount of clinical experiences, just like any other provider.
Something that really stood out to me and has made an impact into the way that I do reporting now was the idea that people who are in communities are the experts of their own experiences. They are the experts of the problems that are in their communities. Before, I had more of the mindset that we find our experts at universities, we find them at state agencies, we find them in big hospitals, and something I've really tried to make an effort with was to treat the lived experience of people in the communities as its own kind of expertise, and to really elevate them as not just people who are there talking about their experiences, but as people who understand the deeply what their community needs, what the problems are there, and what potential solutions could be. Some of the stories that we published ended up being some of the highest page view stories on our website, and a lot of the social media posts that we did ended up being some of our most liked, most commented social media posts. So there's clearly an appetite for this kind of reporting and an appetite for solutions in maternal health.
So UAB has launched a couple of task force that I'm on to kind of address those needs. The state of Alabama has launched a task force that I now sit on, and I can sit at the table with these providers and say, no, like this is what went wrong, this is what y'all are doing wrong, this is where the gaps in care come from, and this is how we meet those needs.
Highlighting this community is so important to me is because I want people in this community to see positive images of themselves. When we post a picture of a Black woman from this community having a positive birth experience outside of the hospital, that lets other young women in this community know it is possible for me, that I can feel loved and cared for and well received during my pregnancy, during my birth, and postpartum. We want to empower those women who feel systemically disempowered. And Black women, we feel the brunt of that in this society. So I often think about myself, what would I want? And having a baby in a birth center is something that I would want when it's time for me to have children. And that's something that I didn't see here. That's an option that wasn't available for me. And having these images here in our state lets people, women in Alabama, women in this community in the West Side know it is possible.